This is In the Loop. I'm Bianca Fascini in for Christian Bryant. Let's get into our top story. Meditation is an ancient religious practice dating back thousands of years as a religious tradition in faiths like Hinduism and Buddhism. And while Western health and wellness traditions have promoted meditation for decades, business is booming the last few years, especially for meditation apps. And by booming, we mean that some of the companies making the most popular meditation apps are now worth billions of dollars. The Calm app, with ads that appear frequently on US TV and with partnerships with celebrities like Matthew McConaughey to LeBron James, was valued in 2020 at $2 billion. And fellow meditation app Headspace merged with online mental health platform Ginger last year to form a company worth $3 billion. So is this just a pandemic-related boom as people think more about mental health? Actually, the numbers show this was a trend that was building even before the pandemic. A report from the CDC found that more than 14% of American adults were using meditation as a health approach in 2017, 3 times as many they found when conducting the same survey in 2012. And the COVID-19 pandemic has left millions of Americans looking for mental health help. Data from the health statistics nonprofit KFF found that in March of this year, nearly a third of all Americans reported symptoms of anxiety or depressive disorder. It's led to people turning to meditation as a mental health tool. Dr. Joanne Frederick has seen the effects for her clients.
It has helped calm their anxieties. It has helped them be in control of calming their anxieties. It has helped them to problem solve better. It has helped them to de-escalate. So even after a scenario, using a common app has helped them to de-escalate from the issues. It has helped them have better relationships with friends, family, coworkers, to name a few.
Now, we don't have a ton of information and studies on the effects of meditation and mindfulness, but the research we do have seems to suggest it might help, and making that more accessible can make a difference.
Maybe the question is not relevant in everyone's circumstances, is like professional care versus an app. It's an app versus nothing. And what we do find is that although apps, when used on their own, lead to consistent but small to moderate benefits in mental health, it may be better than nothing in some circumstances. And I do think that digital tools have the opportunity to scale and provide sort of a base level of access and resources to people who may not receive care otherwise.
That's Dr. Stephen Schuler, a professor at the University of California, Irvine. He's the executive director of One Mind Cyber Guide, a website that rates mental health apps for how easy they are to use, how well they protect user data, and how well they follow evidence-based research. Studies have found benefits to meditation, but the sample sizes for that research tend to be small. And outside of a few of the largest ones, the effects of most meditation apps haven't been studied. Then again, to get the most out of meditation, it takes more than just hopping onto an app for a few minutes when you're stressed, according to yoga studio owner and teacher Arundhati Bhaitmangolkar.
Right? Most people, they're running around, they're on Zoom meetings. The next moment they've opened an app and they're sitting there, their mind is still like swirling. Their body isn't conditioned to hold them in that space. So it's just an unpleasant experience. And most of us think when we close our eyes, it's going to be really blissful. But when we close our eyes and we sit to meditate, we're actually confronted with how troubled our minds can be, how busy our minds can be.
But even with signs of the benefits, there are some concerns tied to these apps and to the business of meditation. Meditation has long been a traditional religious practice in Asia, but the most successful meditation apps are American or European and were created by white men. Cultural appropriation concerns have come up before in the health and wellness world, with both meditation apps and yoga.
There is no give back, right? There is each one of these people, even these meditation apps, and even a lot of things in yoga, how many of them really acknowledge where this tradition came from? And they take the practice and they package it and they get really fancy technology done and PR companies, but there's no acknowledgement.
And some Indian and Indian American yoga teachers who have spoken up about the issue say there's a window to create positive opportunities.
A lot of these tools, and for teachers and practitioners, we all have good intentions. It's not that anyone is out there thinking, oh, haha, I'm going to colonize mindfulness and meditation and steal it, and take it and then do nefarious things with my meditation practice.
Susanna Bargataki is a yoga teacher and author of the book Embrace Yoga's Roots. She says some of the larger meditation apps have a chance to introduce people to more of the original works that inspired meditation.
There's a few things that these apps can do. And, again, one of the most important things is to go to the root of the wisdom traditions. And so to teach the fullness of that tradition, so offer people the rich, diverse teachings. To actually educate on the language, like preserving the language. So South Asian teachers diasporically, teachers in India still, in their apps, go out of their way to actually bring in the people from whom these practices come from.
Now, a lot of people access these sorts of mental health focused apps through their employer. And over the past couple years, we've seen a real shift in how people view their company's mental health resources. Survey data released by Headspace showed that while 71% of workers felt their company paid more attention to mental health following the start of the COVID-19 pandemic, only 25% of workers felt their companies have kept that focused in the last year. There's also this idea that's bubbled up on social media that companies are relying on mental health apps while denying other wellness resources. Here to talk about the role that wellness apps can, or in some cases shouldn't fill in our mental health care, is Russell Glass. He's the CEO of Headspace Health, which owns both the Headspace app and the mental health app Ginger. Russell, thank you so much for joining us here on In the Loop. How have the pandemic era attitude shifts in mental health and accessibility to mental health reshaped your business?
Yeah, well, there was a mental health crisis before the pandemic. We had these skyrocketing rates of anxiety and depression. We had more people considering and committing suicide. And we then went into this pandemic mode, and we saw a massive acceleration of both need and adoption of digital mental health tools like Ginger, like Headspace. We saw a doubling of those who need from 20% to 40%. We saw a more than doubling of those who would try a digital mental health app from 20% to over 50% of the population.
Well, we've seen some worry that companies offering apps like Headspace and Ginger are doing so as they also cut back on broader mental health services. So how do you see mental health apps like Headspace fitting into the mental health care services that people get or from their employers?
We've seen recently through research that we've done called our workforce attitudes research that a huge percentage of the employer population, so employees that are going to work every day, are facing mental health challenges. Over 43% of the overall employee population have missed at least a week of work in the last year. So this is a huge amount of the population that is missing work. They're struggling. They have significant needs. Employers have been offering increasingly tools like ours to help support these populations. But over the last period of time, we've seen a sort of a retrenchment from some employers that they aren't providing quite as much over the last year. They're pulling back a little bit, yet employees are saying there's more need than ever. And this is a little bit of the shift we're seeing, I think, due to cost reasons, due to a significant proliferation of different capabilities that they offer during the pandemic. So it's important that we get the message out there that this mental health pandemic is not over yet.
Well, we spoke to Indian American yoga and meditation instructors who pushed for apps like Headspace to better acknowledge the traditions that meditation originally comes from. So how do you feel your company can connect more directly with those traditions? And how much work do you feel needs to be done to include more Indian and Asian practitioners with direct ties to meditation's roots?
We are very science-backed. And so a lot of the research that we've done over the past decade, over 50 peer-reviewed studies across both companies, many RCTs, have led to the interventions that we have across multiple different both meditation teachers and mindfulness teachers, through our behavioral health coaches, therapists, and psychiatrists that are delivering evidence-based care they're delivering measurement-based care, and we're using all of this research in order to inform our interventions. And that is really what I think is critical as we move forward. And our background being very science-based and being focused on ensuring these interventions work gives us confidence. And you see it in the results. You see people getting healthier. Even with 20 days of meditation, we see a dramatic reduction in anxiety and stress. Even with less than 90 days, sort of 6 to 16 week measurement period on behavioral health coaching, we see north of 50% reduction of anxiety, depression. These are the kinds of outcomes that we look to continue to improve on.
Russell Glass, CEO of Headspace Health, thank you so much for joining us today.
Thanks for having me.